If you struggle from heavy, difficult periods, painful periods with a long-term history of cramping, you might be familiar with the word endometriosis. Endo is notoriously difficult to diagnose and treat. In this video, I'd like to go over what the diagnostic criteria are for endometriosis and some of the common treatments. What I'm most interested about are the energetics around endometriosis. What are those lifestyle patterns, like those belief patterns, and what's going on in our energy field that contributes to the rise of endometriosis? I just had an incredible appointment with a patient this afternoon that I want to share with you and some really interesting outcomes. My name's Allison Lorne. I'm a certified nurse midwife and I practice energetic women's health, spiritually guided women's health. I work in intuitive energy work, somatics, and modern medicine. If you want to learn more, visit healwithallison.com. And if you'd like to work with me, just reach out. I'd be happy to hear from you. When we're talking about endometriosis, right, it is so difficult to treat because it's deep on the inside. We don't have a lot of external values or quantifiable measures that we can use to definitively diagnose endometriosis. The ultimate diagnostic tool is exploratory laparoscopic surgery, which you'd like to avoid if possible. So, if a woman comes to me and she's had painful periods most of her adult life with increasing severity, if the pain is located in the womb but may also extend to the lower back, the perineum, if sex is painful, if bowel movements are painful, endometriosis should be considered. Like I said, we don't have like a lab test or any sort of even physical exam findings, any real testing that we can do to show us if endometriosis is present. And the only thing you can really do is look inside to find it. Even when you do look inside, it's difficult to diagnose because we don't know exactly where to look, right? Anywhere, endometriosis can be anywhere in the abdomen. What it is endometrial tissue, which is normally found in the uterus, and it's growing outside of the uterus. It's responding to the hormonal surges of the menstrual cycle. And so the hormonal surges, like in the first half of the menstrual cycle, they're telling the uterus to get ready for implantation, a pregnancy. And so the endometrium, the lining inside the uterus, is growing, it's swelling, and it's becoming a beautiful nest for a pregnancy to take place. But if it's outside of the uterus, then it's growing and swelling and it's sloughing off, like it's being told to bleed as the hormones decline in the second half of the menstrual cycle. That's when menstruation is triggered, the bleeding is triggered. And these endometrial lesions that are outside of the uterus are going through the same swelling and sloughing. And that's why it hurts so much, right? There's actual swelling and internal bleeding happening, as well as the lesions that spread create this web-like effect throughout the abdomen. And you can get the fallopian tubes involved, you can get the ovaries involved, you can get the bowel involved, you can get the fascia involved, and it creates a sticky mess inside of the abdomen, like a spider's web sometimes. And the actual endometrial lesions can just look like what is referred to as a shotgun spattering. Like it just looks like little black pepper spots throughout the abdomen. And there are even also reports of invisible, translucent, transparent endometrial lesions as well. So it makes it really difficult to find. And even when you do surgically look inside, laparoscopically, that means like taking a little camera through a small incision and looking inside. Even when you do find some lesions, there's the potential for seeding. That is that with the manipulation of the little camera, it can cause those lesions to spread. So ideally, you want to avoid laparoscopic surgery if you can. And if it's just exploratory, it's you have to ask like, is it really worth it to do the exploratory laparoscopic surgery? Best case scenario is that you've come to the conclusion that it is endometriosis through a thorough history of like all your menstrual cycles, how painful they've been over the years, how they've gotten worse. And there may be some ultrasound studies that help indicate that things are affected, even though you can't see the endometrial lesions on the ultrasound. There's some patterns on the ultrasound that can give indication that there are adhesions, that things are being pulled together. So, best case scenario, laparoscopic surgery that is not exploratory, but is actually a treatment that may be removing an ovarian cyst, may have like some other secondary gains, primary gains, and the secondary gain would be diagnosing the endometriosis. But being able to remove any adhesions or endometrial tissue in that intervention, that's kind of the best case scenario. Our first treatment is usually birth control. And the reason that works is because it suppresses those hormonal surges that we have in the menstrual cycle. So that tissue isn't no longer responding to the hormonal fluctuations of the menstrual cycle. That's why hormonal birth control works to treat endometriosis. And there are even some other medications that completely create a cessation of the menstrual cycle. Um, and those can also be helpful. Now, there are still times when endometrial tissue is persistent and needs to be surgically removed, and that has again and again become the best way to get rid of the endometrial tissue. And I'd like to speak to my patient that just came in this afternoon. She's just post-op, a few weeks now, and this had been years and years in the making. So her pain's so bad that she was really having difficulty getting to work and maintaining her normal daily life. I've actually worked with her before a little bit in somatics, but it had been a while, and she got sourced out to an obstetrical surgeon, a specialist in endometrial management because her pain was so severe. So, it was probably a year in the specialist care before she had surgery. And now that she's had surgery, she came back because it's like, let's treat this energetically to get to the root of why the endometriosis was happening in the first place and clear the slate so that we can really like anchor these gains from her current medical management and pave the way for her to have like a pain-free future. Now, I say that somewhat guardingly because she's still having some pain, she's still having some symptoms, and some of that's to be expected. Things need to settle down, and it was a big shift for years, decades of having these adhesions inside and having this pain to having it cleaned up. It's the body still remembers the old way of being. It's like not just open the door and all of a sudden it's a whole new world. There is actually a habit of energy that wants to still hold on to the way it was and has a hard time even like believing that there's a new normal. So a lot of this is shedding the old attachments to the pain. And I know that sounds crazy, but when so much identity is tied up with the suffering, then it's hard to suddenly let go. Even though you know you want to, it's easier said than done. And the body still remembers. It's just habit. It's just habit of thought and habit of being. This woman, when she got her first cramp when it was time for her period, would have a lot of anxiety. She would start her regimen of ibuprofen and Tylenol and her herbal remedies as well. And it was just like she would go into management mode, an anxiety driven loop about fearing the pain that was going to be coming with the menstrual cycle. And this would start like a week before she actually started bleeding. So that habit has been like deeply encoded, and it's a lot for her to let go of. So some of this work today was about, right, settling into a new normal, finding a way to relax into the womb space and believe that there's like a new paradigm, that there's a new reality available to her. It's such beautiful work, and I'm so glad she came back. What's really interesting is getting into the energetics because the endo work really kind of happened at the end of the appointment. What came forward for her first when we tap into the body, and it's like, what's up for you right now, was that her throat felt tight. And what's really interesting is that the throat and the vagina are almost mirror images of each other. It's like if you cut the body in half and folded it over, like the shoulders at the would mirror the hips, the arms mirror the legs, the throat mirrors the vagina, the glottis mirrors the cervix, right? So here we are in the throat, and there we are in the vagina, like in the womb space, that second chakra, right? It doesn't even have to be specifically like cervix, uterus, vagina, but just the throat chakra and the second chakra, right? They're connected. So the second chakra being the reproductive organs, the vagina, the womb, that's all our sexuality, but also in women, really this great creative potential. The womb space is a direct line to our relationship with our mother. Also, from that line, all the matrilineal ancestors, right? So the grandmothers in there and the great grandmother and going back infinitely. It's like till the first ancestor, right? So when we're talking about energy work and healing the womb, sometimes the trauma that's in the womb isn't even just this life, but inherited trauma. I'm not sure if you've heard this, that you were actually present as an egg in your mother's ovary when she was a fetus in your grandmother's uterus, right? So when your grandma was pregnant with your mom, you were there. Part of you was there. The egg that was gonna be you was already in your mom's ovary. Isn't that amazing? But what that means, biologically speaking, right, is that there is a direct line of experience that goes to your grandma. Like it, we can just say that that biologically speaking exists. And from that, you can imagine that this line goes back and back and back, right? So your mother was an egg in her mother's ovary when she was in her grandmother's pregnancy, right? So it keeps going back and back and back. So what we inherit, what we receive, what's transmitted, right, in that coding, right, in that inherited genetic, right, direct line is true. It's real. And sometimes I'm just saying this like the trauma, the wounding that we're asked to show up for and heal is sometimes is even bigger than just this life. It might be bigger than just your relationship with you and your mom, but it might also tap into your mom's relationship with her mom. And then that mom, grandmother's relationship with her mom, and then that great grandmother's relationship with her mom, and it keeps going back and back and back. And this isn't to say like it's out of your control, but sometimes it feels like it's out of your control. Sometimes it feels like it's too big to make any sense of. And that's why I'm bringing this up because you don't have to make sense of it. It doesn't have to make sense. Sometimes it is too big. But if you're feeling it, if it's showing up in your body, then it's asking you to heal it. Woof. And can you heal it? Like you have to feel it to heal it. Healing it is opening to the somatic experience of what is going on in the womb. So just want to check in here. The patient that I had this afternoon, she was talking about her mother and the reason her throat was tight. She was literally feeling like she was being strangled, that she didn't have a voice, wasn't allowed to speak up for herself, wasn't able to advocate for herself in her relationship with her mother. hmm And she had a very protective attitude about herself. Protective, you can also read that as defensive, right? You can also even read that as offensive, right? The best defense is a good offense. So I'm not saying that's true. I'm just saying that that's like how we often operate, right? Fear, which is what came up for her, will often drive us to distancing ourselves, breaking connection, isolating, guarding, and even pushing away through actively pushing away. And when we got into this fear, the physical experience of fear, so in the somatic part of this practice, we're asking, where is the fear? What does it really feel like? How do you know it's fear? Right. Fear usually feels hot and frenetic, like it feels frantic, it feels panicky, it feels shaky, feels like accelerated heart rate, might feel tingly, it might feel like there like an impulse to want to do something. It might be freeze, fawn, fight, or flight. Any of those trauma responses might be coming up, and it's asking like, can you feel it? Can you let the feeling come through you more? I'm always saying, can we turn up the volume on the experience? Can we feel more of what's asking to be felt? So we're in this somatic practice exploring these feelings. And we get through the fear. We find a gesture that helps her interrupt this pattern of fear and a new response of worthiness. Yeah. Finding worthiness in her communication, worthiness in her relationship with her mother. We get on the table and feeling into her energy field and just what I know about endometriosis, about it being like this web of adhesions, about the womb representing this matrilineal line to the ancestors, around the potential for healing, the need for healing this. She's had her surgery, she's cleared out internally. Like, how can we pave the way for this to not return? Right? It's like, how can we let go of this need for guarding? Woof. And then we had just worked with this fear, right? How can we make friends with fear? How can we allow fear to be in the body and not resist it? Can we welcome it? I like to say I eat fear for breakfast because now when you taste your liberation, when you taste the power that's on the other side of your fear, you're like, where is it? Show me where more fear is because I am hungry. I'm hungry to feel myself, to feel my power, to reclaim the part of myself that I pushed away because I was too scared. Whew, this was such a powerful session. This was so beautiful to see her unfold in this way. And the downloads, the messages that I was receiving that were coming through were just landing. Um, like she said, so many people say it's like 10 years of therapy in one session because it's combining, right, this healthcare aspect with the energetics and investigating what are the belief patterns that are contributing to this condition. It's not like a psychosomatic approach to healthcare where everything just comes down to belief patterns. This patient greatly benefited from surgical intervention. And like I said, I saw her for a period of time, like a couple years ago, and she had to go through medical management. Like the symptoms had continued to get worse and worse. And she has great relief from having had her surgical intervention. But at this point, it's like, what can we do to correct this energetic relationship with the disease, to smooth things over, to create a better pathway for energy to move through her so it doesn't get stuck, right? This truth getting caught in the throat is just about her correcting her relationship with her mother. It's about her finding balance, finding strength, finding courage in speaking her truth, advocating for herself in her relationship with her mother. The mother wound goes so deep. There's so many layers to it, but it's like you can't just meditate that the dishes are done without doing the dishes. That's what I told her. You can't just like correct the nervous system with the somatic practice without taking action in the real life, right? So, this step of healing the relationship with the mother, it's like, what are you going to do in the next 24 hours that is going to show your nervous system that you're serious, right? That you're actually committed to this change and identifying strategies for how to do different next time this feeling comes up. It was such a lovely session, and I really wanted to share these insights of what endometriosis showed us in this case study. It's not going to be the same for everybody. But so often, gynecological conditions, womb conditions, especially, are related to that matrilineal healing, that line, yes, that heritage, so to speak. And if it's not just this generation and something that you can put your finger on, sometimes it's something even beyond you. It's not so important, the story. Like today in this appointment, it's not like she's telling me, replaying a conversation that she had with her mom. She's not telling me about this like fight that she had with her mom. It's patterns of being, it's habits of thought, right? And this is where the energetics are, right? So, energy, like physical reality, is condensed energy. And if we can capture thoughts and beliefs, and correct them before they're filtering through into the physical realm, they might not even need to get into the physical realm. One of my favorite sayings is listen to your body when it whispers so you don't have to hear it scream. Yeah, if we can catch these beliefs and thoughts and patterns before they turn into disease, then we're able, right, to change the course on the energetic side. Yeah. Yeah. I hope that you find this helpful. Please comment below or let me know if you have any other questions, if you'd like to see other aspects of this conversation addressed. If you want to reach out and work with me directly, healwithallison.com. There's links on there for a discovery call or to schedule appointments directly. I'd love to hear from you, and thanks so much for watching. Bless be.